Hi, everyone. As you know, I'm Steve. I'm here with Dr. Robert Floyd, who is a functional physician in Reno, Nevada. And we're going to talk about peptides. We're going to get peptides are all the rage right now. You guys know I love talking about peptides. We're going to talk about peptides in general, the benefits, who should be doing it. Personally, I think they're about to explode. They've been around for decades, but I think they're about to explode and really come on the scene there's a peptide for everything. So, first, Doc, tell us a little bit about yourself.
Thanks for having me, Steve. Great to be here. I'm a board certified MD. I've done a lot of things in medicine. I've had a very circuitous route through medicine, finally landing in functional medicine. I wanted to be an orthopedic surgeon, wasn't cool enough to get in the club. Then I did 2 years of trauma surgery residency in Vegas, and then 3 years of family medicine in Reno. And then went from there into emergency medicine and hospital medicine. Did those for a couple years, and then luckily I found functional medicine, which to me is a really good type of medicine. It's root cause medicine. It gets to the root cause of medicine. I was trained in a system that's really, really good at saving lives. If I get hit by a bus, yes, take me to the ER, please. But we're really good at stopping heart attacks, trauma, infections. But the acute care model is great in Western medicine, but sadly, the chronic care model has been hijacked by, the big pharma, and they want to diagnose and treat. Their whole model is diagnose and treat, diagnose and treat, diagnose and treat. Here, just give them medications and that will cure everything. I've learned that, most of these medications, they're not curing anything. They're just really masking symptoms. If you have high
Causing
blood
more
pressure, what's that?
and causing new symptoms.
Absolutely. I learned in medical school that these medical medicine interactions, if you are taking 8 medications, you are guaranteed one adverse medicine interaction between the two, which could be life threatening. And so, again, what I really realize is that, these chronic medical deficiencies, these medical problems, they're not a deficiency of pharmaceutical medications. Their pathways gone wrong in the body. And so that's what I really love about functional medicine. It helps get to the root cause of why. Why do you have high blood pressure? Why do you have psoriasis? Why do you have fatigue? Why do you have brain fog?
Yeah. Well, I'm a huge advocate. Anyone who watches my channel or any of them knows that I'm a huge advocate of functional medicine. So let me just say, I'm not a doctor. I'm a gym rat. Now, he is a doctor, but he's not your doctor. So, you guys got to do research on your own. Whatever we talk about, we're not making any recommendations for anybody or saying do this or do that. You need to talk to your own doctor include them in any decisions that you might be making as far as supplementation or whatever we talk about. So peptides, I love peptides. Let's just talk about, we talked before we turned this on, we could go forever. We'll try not to, but peptides, they've been around for a while. Most people who watch me know that they're a chain of amino acids, mostly short chains of amino acids, less than 50. And I know that you're interested in them also, functional. So why don't you give us a brief description, or why don't you tell us where you think medicine is going, or maybe not just medicine, but where health is going with peptides? Where do you think this is going to go? Because personally, I think it's about to explode.
Yeah, I would agree 100% with that. I think peptides are going to be kind of the next frontier in medicine. That, along with a lot of individual tracking, the Whoop, the sleep monitors, the Aura Ring, and all that stuff. A lot of those things are going to be the cutting edge of medicine because as a human being, we're all individual. I'm very different from you. My biology, my physiology, we're all humans, but we're all very, very, very different. Like one medication might work well for you, but it doesn't work well for John Doe. Um, I also think that this is another topic that we can talk about later. Exosomes and stem cells are going to be they're going to blow up. And I'm really trying to start focusing on exosomes as well. But peptides, let's go back to peptides real quick. Peptides got started in the research in Russia, actually under biological warfare. And they started in 1928. They started doing research in the late 20s in 1928. And they've been doing research and research and research. They've been the cutting edge of research on peptides basically for the last almost 100 years. A lot of these peptides were for, improving their soldiers, improving their longevity, improving their stamina, their endurance, their strength. And for some reason, I don't know why, but obviously we've all seen how the Russian, on Rocky, the big fighter that he's fighting is this huge buff dude, and they've always gone with however they can manipulate their athletes, right, or their warriors. And so peptides really got the start in Russia in the late 1920s. And, what they are is, like you said, they're short chains of amino acids. They're signaling molecules. Most therapeutic peptides, that's what they are. They're signaling molecules. They're not drugs in the traditional sense. They amplify or restore normal physiology rather than override it. Okay. So, again, Western medicine, I give you blood pressure medications, you're overriding the normal physiology. If I give you peptides, that can actually show you, that can tell your systems to say, hey, we need to increase more growth hormone. Hey, we need to increase more glucagon, things like that. And peptides, again, they are really just around, excuse me, to really help. I like to say that the human body is absolutely genius, right? So peptides, all of us make peptides in our body all day long. GLP-1 is, we make that when we eat bitter like Brussels sprouts and cabbage. It's already made inside your intestines. Big Pharma has figured out how to make GLP-1s, and that's going to be the biggest moneymaker for them forever. Like, that's going to make trillions and gazillions of dollars. But it just shows that, like, our body knows what to do because it's genius, right? And so these peptides are just signaling molecules. When you get out of whack, you're overweight, you have brain fog, you have fatigue, you can take these peptides, and a lot of them are actually, they're signaling molecules. They will attach to the outside receptors on the cells and then tell the cells how to improve.
Now, when you say, because this is what I say, the gym rat, peptides are going to be more valuable or have a better effect with people who are older. Like, I take a lot of peptides, and I want to get into, a lot of these influencers and doctors just arguing with each other and at each other's throats. You said it. Everyone's different. Everyone is different. So I have a way of testing things and doing things for myself to see if this study applies to me, but I kind of went down a rabbit hole. Don't you think, because I know a lot of the peptides I use now would have done nothing for me when I was 22.
For sure, absolutely. Again, that's like that's a really good point. As we age, that is, who are peptides for, right? That's a good question. Number one thing that we like to use peptides for are age-related decline. As we age, especially for men, your testosterone levels drop, right? You can use peptides to increase that. You can use bioidentical hormones. Ideally, like we talked about before we started, ideally, functional medicine, you would improve your diet and detox. You would improve your sleep. You would improve your exercise. You would improve your stress reduction. All of those things are going to help you better your biological, physiological systems, right? A lot of low testosterone is caused by inflammation. It's caused by excess weight. It's caused by poor signaling pathways in your body, inflammation, and so on and so forth. But peptides are the number one thing that I'm using peptides for is age-related decline. And that's, again, I brought up testosterone, but another thing that we use in my new studio called Degree Wellness is NAD plus. I'm sure you're familiar with NAD, right?
I love it. I use it.
Yeah, it's an amazing molecule. It's a cofactor in mitochondrial ATP, the electron transport chain, making ATP, which is the currency of energy for humans. And just like testosterone, NAD as we age decreases. So again, the number one thing that I'm thinking for peptides is, well, it's for age-related decline. It's for people who have injuries. It's for peptides are for people who have, systems out of whack, out of balance. Again, first and foremost, you have to adjust and improve diet, lifestyle, exercise, stress reduction, all that stuff. So that's my 2 cents on that one.
Yeah, it just makes me think. I was talking to one of our staff members at one of our clubs, and he's 18, and his IGF-1 is 500, and he's talking to me about, should I take growth hormone or should I? I'm like, going, what? Why would you do that? You know, where my baseline IGF-1 is 80. His is 500. There's a big difference. Growth hormone secretagogues, tesamorelin, CJC, 1295, impamorelin, my body's gonna suck that up because my IGF-1's 80. His is 500. If he if he does that, it's a signaling mechanism. His pituitary gets a signal, "Hey, growth hormone." His pituitary is gonna say, "Screw you.
Yeah,
How
exactly.
much do you want?"
Again, our bodies are genius. Like, I will say that all day long. And the thing is, if you actually add too much, you keep signaling. Eventually, what happens with testosterone is when you start taking exogenous testosterone, meaning testosterone from an outside source, your testicles stop making it. Hypothalamic pituitary adrenal axis, your gonadal axis, it changes because your body says, hey, okay, I don't need to make that anymore because now I have a bunch of it. And the same thing, again, people, like you said at the very beginning, if this is not medical advice, I am not having a doctor patient relationship with any of your viewers, but it's very, very important for them to do research. And sadly, I hate to throw this term out there because it's such crap, is there's a lot of misinformation out there and a lot of disinformation out there. People just trying to sell their shit. I was reading recently, Ben Greenfield has a lot of great information on peptides from like the 2021, 22. And he said that one of the people who, I forget what it was, someone was doing research on peptides and he said 80% of the peptides out there that you could buy online didn't even have any of the actual peptide in them. So you have to be very, very careful. You can't just be that a gym rat bro. Like I've got some clients who, yeah, they come to me because they've been buying, testosterone or other steroids from their buddies at the gym. I'm like, dude, you can't do that, man. You totally have to get it from a reputable source. And I get my testosterone from Strive Pharmacy, which is an MCT oil, which actually I like because it's less inflammatory than seed oil. But also, you have to test, right? I like what you're doing, and you've really excited me, and it made me want to test myself more and more and more. I need to start testing more. Like you told me your testing regimen. I was like, holy crap, dude. But that's good. And that's another thing we say in functional medicine: test, don't guess, right? So tell me about how often you're testing all of your labs. I need to go get mine tested way more often.
I'm about once a month right now. And hey, it's expensive. Fortunately, I have the resources to kind of put into this, and it fascinates me.
Hmm.
And that I tell people, look, you hear this social influencer, this doctor arguing with this one, this guy's trashing this guy, and it's hilarious. And you just said something. It's not medical advice, but it's phenomenal advice. Do your own research
Yeah.
because people get online and they just repeat things. They just repeat what somebody else heard, and they trust that that person even read the research or even did their own research, but they didn't. They just repeated somebody else that they trust, that they trust, that they trust, that they trust. It's like you go around in a circle and you say that this person starts something. By the time it gets around through 10 people, it's something completely different, but you're repeating it. So that's why I get blood work done, because you said something else. Everyone is different. Everyone is different. And your body, when they do these studies and they do this research, they have 100 people, they have 500 people. Why do they have 500 people? Well, because everyone's different. If everyone was the same, they would only need one person. One person. How many people in your study? One person. Everyone's the same. We all know that. So that's why. Okay, well, 500 people are going to respond differently. And if they say, oh, this is this, there's evidence that this does this. Well, what if you're the one out of 500 that it didn't do that? That study is totally irrelevant for you because you're different. So that's why I do the blood work. And I'm doing it a lot now because I want to see what peptides, what products will get my IGF-1 up where I want it. My baseline is 80. So I tried a few peptides and one of them got it up to 110. A combination of a couple other secretagogues got it up to 130. Tried some things that were even more direct. 15, I'm going, okay, I wanted a little higher. So I tried something else and boom, 280. I'm like going, IGF-1 jumped to 280. That's insane. So
Which
that's
which
why,
which one did that?
okay, you want me to tell, huh? That
Yeah,
was growth hormone directly.
straight growth hormone. Okay.
Right.
Yeah.
So I tried all the secretagogues. And if you look at from 80 up to 130, that's a pretty good increase. No,
Mhm.
I'm not going to, I'm experimenting. I'm doing research on me. So that blew my mind. A very small dose, 2 IUs, blew my IGF-1 out of the roof. But my growth hormone was zero point 0.3. That's crazy. That can't even be right. Zero point 0.3, you don't want your growth hormone under 5, but it really fluctuates. So that's the one that did it. Now, am I going to stay on that? No more than 8 weeks. And then I'll get off, go back on the other secretagogues. But to answer your question, that's why I'm doing my blood work. What's my hematocrit? Because I'm on TRT. What's my hemoglobin? What are all these measurements? I want to know what they are because I want to know with my diet, which, by the way, again, rabbit trail, you got to start with your diet because you don't know what you need until you fix your diet, your sleep, and your exercise. You don't know what you need. You're throwing something at something that you don't need until you fix the basics. So I have a very strict diet and I exercise. I'm in the gym for an hour and a half, sometimes 2 hours. Well, a lot of time, 2 hours in the gym, 5 days a week. That's a lot of exercise. That's 10 hours. So I think it's really, really important for each person to get their blood work done. I'm doing it every month right now because I'm testing some certain things, but I don't go more than 3 months without getting tested. And there's certain markers that I want to know depending on what I'm doing for my health. And, you could probably guess, I want to know what my testosterone is. 90, this might surprise you, 90 milligrams of testosterone. That's all I take. 30 milligrams Monday, Wednesday, Friday. That will put my total testosterone up to 1,000. My
Perfect.
free testosterone is out of the roof, out the top, but that's because I use boron. But how do I know this? I have to test myself if I want to know what this is. So those are some of the markers that I test. Does that kind of answer your question why I do it?
Yeah, no, it's great. That's and more people should be doing that. And you know what's really sad is that again, the whole industrial medical complex is basically racketeering. I mean, like you have people like I told you I have guys come over from the gym who've been getting their thyroid or testosterone replacement from some bro at the gym and they're not testing. And when I test for testosterone, I test for testosterone free in total. I test for PSA. I test for hematocrit. I test for iron. I test for a lipid panel because testosterone could change all of these. But I also test for estradiol and DHT because when you take exogenous testosterone, your estradiol can go up and your DHT can go up, and you don't want either one of those. So, like, again, back to the medical industrial complex being racketeering, like I send someone to get labs done and they're like, oh, yeah, those labs were $1,800. I'm like, what the F are you talking about? Well, the lab is going to bill their insurance $1,800, quote unquote, so that they can get reimbursed a lot of money. Whereas if you just pay somebody cash, you can go to Cash Clinical and get those same labs done for like $400, or, even cheaper sometimes. It's super important to test. Again, test, don't guess. So, like, the reason why I do all of those labs for TRT is because, too much estrogen can lead to really bad outcomes. Estrogen Too much estrogen is linked to cancer. Again, it's not like, oh, if you have a little estrogen, you're going to die. But also, too little estrogen is linked to very bad outcomes. Estrogen is super cardioprotective and bone protective for men as well as females. And so I've had guys, they're like, oh, yeah, I'm taking TRT, and then this guy's giving me this anastrozole, and I take it all the time, and blah, blah, blah. And I check their estradiol, and it's like less than 5. I'm like, whoa, dude, you have to have estrogen in your body. It protects your heart, it protects your bones. So that's why I do how I do it. And like, I get people on my lab. I get my TRT patients on labs at 3 months, 6 months, 12 months. And then once they get steady, I go yearly. It's actually a pretty bad business model for myself because I should see them more often, but so. But anyway, we kind of got sidetracked because we were talking about peptides and now we're talking about TRT, but that's fun.
Yeah, but I mean, that's the next thing I think is you get your eating right and all your basics right. Well, then hormone replacement, if you need it, would be next. Then come the peptides. And
Exactly.
all those tests that you mentioned, I get them done. Every time I get them done, my PSA I know is at point 0.5, which is very healthy. Estradiol and anastrozole that'll tank your estrogen, but it'll also chew a hole in your liver.
Yeah, and anastrozole, I'm not a big fan of it, actually. I get people on, Estrodim, and I like people's testosterone levels, or I'm sorry, estradiol levels in the 20s to 30s because it's really cardioprotective and bone protective. So it's really important. Again, you gotta measure, you gotta measure. So, one of the ways I got back in, let's go back to peptides real quick. I started deep diving into peptides in COVID. I'd heard about them during COVID. Thymosin alpha is an amazing immune modulator. So, and then when I got COVID, I did some IV stuff at my old clinic, and then a bunch of thymosin alpha. I was over COVID in one day, and I think it's also because I have a healthy baseline. You and I fortunately value our health a lot, and we know how to achieve good health. Not That's not saying that I'm not going to walk out my front door today and drop dead of a heart attack. Shit happens, right? I mean, healthy people drop dead, but health is the first wealth. And that's why I like going back to peptides and functional medicine. How do we use peptides in functional medicine? There's a whole bunch of different ways that we can do. We do repair and recovery, again, tissue healing, post-injury recovery. That's another thing. Post-injury, you train hard, you hurt your body. Guys that hurt their body. I train jujitsu, I ride dirt bikes. I know people who are injured all the time, and one of the best post-injury recovery peptides is TB500 and BPC 157. That combination, I have seen people heal, and I've healed myself with those. Like, I had a friend of mine, he had elbow surgery. He crashed on his dirt bike, tore his elbow, and I got him on BPC 157 and TB500. And the orthopedic surgeon's like, dude, how did you heal so quickly? And it was just that. Again, it's what we use peptides for in functional medicine is to improve the signaling pathways that are already in our genius body. So TB500, BPC 157, they go to the inflamed, injured tissue and help it recover better. So then, for metabolic regulation, another reason we use peptides in functional medicine, it can help with insulin sensitivity, appetite signaling, mitochondrial function. You and I talked about peptides for mitochondria. I am really excited to do a MOTC cycle. And what is it? Not LR22. What's the other one you told me about the other day?
SS31.
Yeah, yeah, I'm gonna get on that too. And I was doing some research on that you need that one. It's good to use that before you get on the MOTC because the SS31 is gonna help with improve the mitochondrial health before you want it to make more energy with the MOTS-c. Again, I talked about immune modulation with the thymosin alpha, and it decreases inflammation. It increases the gut-brain barrier. That's one of the problems that I see in most everybody in America today. Everybody has leaky gut. If you have leaky gut, you got leaky brain, you got generalized inflammation, you're at an increased risk of autoimmune disease. Then again, what else?
BPC and KPV for the gut issues.
Yeah, the BPC 157, that's is a really popular one right now, and what's funny is our bodies make BPC 157 already. They already make it in the small intestine, and it's actually called body protective compound, right? So, again, our bodies are freaking genius. So, I've actually you could take some peptides orally, but most of them, they can't stand the stomach acid, but BPC 157, everyone's like, here's another thing that we talk about, you and I've talked about, like, a lot of people don't know how to use peptides, right? A lot of people don't know that, you get them, you have to use bacteriostatic water, you have to dilute them to get the water in the powder, then you have to store them appropriately, you have to use them within a certain amount of time, you have to make sure that you're always using an alcohol swab on there and on the top of the bottle, on your skin, wherever you're going to inject. People are afraid of needles. People are definitely afraid of needles. So there are a couple of, if someone wanted to just kind of jump a little foray into peptides, BPC 157 is a good one. There's actually, I had this, I was at A4M, the American Academy of Anti-Aging Medicine conference in Vegas in December last year. And this company called Infiniwell, Finniwell, they make this BPC 157 chocolates. They were delicious, man. They were amazing. And it also had what's called cognizine in it, which helps with the cognition as well. And I actually was going to buy, they were out of stock, sadly, because I'm going to buy, I still have it, and I'm going to buy for my family for Christmas gifts because it's awesome, man, right? BPC 157 decreases inflammation, makes you feel better. Anyway.
Yeah, I mean, the last thing I'll say is that, with BPC 157 and TB 500, when we talk about peptides having a stronger effect on people who are older, I'm 63. So taking that, BPC was okay by itself, but when I added in the TB 500, boom, that's when it really happened for me. And I noticed someone in their 60s who trains pretty hard like me, the muscles recover. It's the connective tissue that takes longer to recover. So
Hmm.
if from a hard training session, you're doing heavy squats or whatever, deadlifts or bench press or whatever it is, my muscles can still recover. But the connective tissue, it's like, oh, my shoulders feel a little tight from the last time I did bench press. That went away with the BPC and the TB. And so what happened was I could lift heavier again without the joint pain. So I'll just stick the BPC, right in the joint or wherever, upper bicep. And I realized that as I've aged, it's my connective tissue that's not recovering. My muscles are doing fine. I'm lifting weights if I want to, that are nearly as heavy as when I was in my, when I was 28, 29, 30, because
Hmm.
of that, because it's allowing my connective tissue to recover faster where my muscles are already recovering. You have any last thoughts on peptides?
Yeah, I mean, again, this is not medical advice. I do not have a doctor-patient relationship with any of you watching this. What we do know about peptides, they've been around for decades. There are lots of them that are FDA approved. Okay. Insulin is a peptide, Sermorelin, GLP-1 agonists, all of those are approved. One of the reasons why a lot of them are not approved currently is because it's the medical industrial complex. Some of these big companies can't make money off them, but once they figure out how to, they will then be approved. There's like 78 approved peptides out there for use right now. Another thing is that a lot of them have been studied over and over and over. Like I said, they've been doing research on peptides in Russia for almost 100 years now. Like 98 years they've been doing research on these. There's a lot of research in America about them. And then the compounding pharmacies, they've taken big hit on peptides lately because the FDA is cracking down on them. So again, it goes back to do your research. I will tell you, there's Ben Greenfield is an amazing author, biohacker, longevity expert. He's done a lot of research. If you're looking into peptides, you can go to Ben Greenfield. Another guy who is a former bodybuilder, Jay Campbell. I trust him tremendously. His information is very accurate. You know, you were talking, Steve, earlier about a bunch of these people talking about, well, this guy says this on Instagram and this guy says this and this, blah, 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 blah. Listening to someone on Instagram is not doing research. Flat out. That is not doing research. Okay. I will laugh when someone says, yeah, I did some research. I saw it on Instagram. I say, shut the F up, dude. That is not research, bro. Okay. When I'm saying do your research, deep dive into Ben Greenfield, Jay Campbell. These guys are trustworthy. Okay. Sure. Yeah. They have companies that make money. Yes. Of course. Is there a conflict of interest? I don't believe so. There may be, but again, you gotta learn from the people in front of you who have done all the research first. So that's super important. You know, one of some of the things we don't know, what are the long-term population outcomes for newer peptides, right? We don't know that. I'm the GLP-1 agonists. I'm a totally not a big fan of. Yes, they can help with you know, getting you over the hump for that weight loss, but you're doing the what was the other one you talked about with Dr. Nario, the retatrutide?
Yeah, I'm a huge fan of that.
Huge fan of that. Yeah, that's actually a little bit different. Again, that's not FDA approved at this point because big pharma can't make money off of it, right? And other things that we do not know is the optimal dosing across diverse populations. And some of these marketing claims can be a bunch of BS as well. And again, you got to know where, if you're going to get peptides, where to get them sourced properly. It's got to be a good clinical manufacturing process. It's got to be CLIA certified. It's got to be 99.9% pure. Like, and do not buy peptides from China. I would highly advise against that. Peptides are going to be, once they become more mainstream and the way when the FDA says, okay, this can be approved, this is going to be good for us. I think that we're going to see that they will explode because there's so many benefits to them. And there's little downside to peptide therapy.
True. Yeah, the Russians, you know, I used to watch the Olympics, the weightlifters a lot in the 70s, you know, and there was some guy named Alexia. You know, they always won everything. The Russians, they always won all the Olympic lifting contests and everything. I remember that back in the 70s. So, Doc, if people want to find out more about you, they want to reach out to you, they want to contact you, how do they do that?
There's a couple ways. One is Empowerment MD, EMPOWERMENT MD .com, or also Empowerment MD on Instagram, Robert Floyd MD on TikTok. Got like 95,000 followers on there. And then Empowerment MD will take you right to my website. And then also, you and I will talk about on another podcast is Degree Wellness right here, which is a health and wellness studio that we're opening up in April here in Reno. And you can go to Degree Wellness South Reno, all separated words, and that will bring you to a founding membership page. Real quick on that, it's going to include cold plunge, cryotherapy, compression therapy, infrared sauna, red light therapy, oxygen therapy, and advanced nutrients, IVs, and shots like NAD, glutathione, B12, D3, proline, all sorts of great stuff for basically functional medicine, longevity, biohacking to really truly get you and your health as optimized as possible. And so, again, it's all functional medicine, it's all science backed, and it's to improve your wellness and longevity. Again, that's Degree Wellness South Reno.
All right, Doc, thanks for being with us.
Yeah, it's super fun. Can't wait to do it again. And you and I can have lots of conversations. I mean, that was 40 minutes right there. Just no time at all.
Yeah. All right, I'll talk to you next time.
All right. Take care.